My name is Jen Shull, and I am here to talk about my experience, my family's experience with childhood cancer. I'm a Marine spouse. My husband and I have been married for 14 years, and in 2011, he came home from a deployment, and we took post-deployment leave and went home to visit family and friends in our home state of Michigan. While we were there, our then 20-month-old daughter, Lily, began doing some things that were just not quite right. She was sleeping a lot, and she no longer wanted to walk independently. We became more and more concerned as our trip progressed, and these things didn't change with her. And we called her pediatrician in North Carolina. He advised us to take her immediately to a pediatric emergency room and to tell them that she needed a full workup. We spent a couple of hours there talking to them, letting them observe her. We were transferred to the University of Michigan Mott Children's Hospital, and the doctors observed and watched her and asked us lots of questions, and finally they took her in for a CT scan. It was about an hour, and the doctor came out and said, "We think we know why she is having trouble with her balance and walking, and it's because she has a large mass on the top of her brain. And not only the mass itself is probably causing her problems, but she has a very high amount of pressure going on in the brain because of the mass." At that point, the next step, we had to wait for her to get an MRI so that they could have a more in-depth look of her brain. She went into the MRI around 11 p.m. It was a Friday, and they told us that we wouldn't talk to the doctors that night. It was too late, but they would come see us first thing in the morning. So they transferred us to the PICU overnight for sleeping. The next morning, the neurosurgery team came in and told us that they saw the mass on the top of her brain in the MRI, and they also found in the images a mass in the back of her brain near her brainstem. Their recommendation was to go in, and they could not operate on both of the masses, and so the doctor felt that the one in the back of her brain was a little bit easier to access, a little less risky, and that he would biopsy that one to see what we were dealing with. We were scheduled as the first surgery on Monday morning, so we stayed through the weekend in the ICU, and everywhere we went, all the doctors and every nurse that came on rounds would look at her as their patient, and they all asked us, "So has she been vomiting a lot?" And no. If she'd been vomiting a lot, I would have had her at least into her pediatrician by now. Sunday morning, Lily woke up on my lap and threw up everywhere. The nurse immediately called for a team, and they rushed her down to the OR to put an external drainage tube into her skull to try to drain some of the fluid that was building up and causing her all this pressure. She had a ventilator, and they said, "We're going to leave that in because she has this 10-hour surgery tomorrow, and she's going to need it then. We don't want to irritate her throat by taking it out today and then putting it right back in the morning." We said, okay. So the next morning was the surgery. Finally, after 10 hours, the doctor came out and told us that he got about 75% of the tumor in the back of her brain, and he was 99% confident in his guess was that it was a malignant cancerous tumor called ATRT. And that's about all he said. We immediately jumped online and started looking up ATRT, and the prognosis was heartbreaking. Most children do not survive initial diagnosis, and there's no cure. There's no protocol that is saving lives. There are protocols, multiple, that have been tried. Some did work for some children, but most of them do not work for most children. On top of that news, if we were fortunate to get through the first initial diagnosis, most kids relapse. It comes back within 1 to 2 years, and relapse is harder to beat than initial diagnosis. After the surgery, we had a long 10 days ahead of us. Lily was not able to come off of the ventilator. She wasn't strong enough to breathe on her own. We could not start chemotherapy because being on a ventilator with a breathing tube, she was high risk for aspiration. Finally, we got the breathing tube out. She was breathing on her own. We did a scan just to see again where we were at, and the tumor in the back of her brain that the doctor had gotten 75% of was back to its original size. That is how fast ATRT grows. So we were back to square one. She did not speak. She could not eat by mouth. She had a feeding tube, and in the weeks after the surgery, she was not even strong enough to hold her own head up. We did 5 months of high-dose chemotherapy with 3 stem cell rescues, which were harvesting her own stem cells and then giving them back to her after chemo to try to help her bounce back from the effects of the chemotherapy. In those 5 months, Lily had normal side effects of the chemo. In those 5 months, we were able to bring her home a total of 3 days because she just didn't bounce back from the rounds of chemo very quickly. We would end up monitoring her in the hospital in between rounds because of issues she was having. After those 5 months, we did 1 month of maintenance chemo outpatient to just make sure we were keeping everything in check before she started the 6 weeks of proton beam radiation in Chicago. We went to Chicago and lived in a hotel and did that every day, Monday through Friday. She went in for an hour of radiation. This was now 9 months after her diagnosis. We seemed to be in the clear. She had a small cloud on her scans on top of the brain, but after watching it and seeing that it was not growing, and we know ATRT grows aggressively and very quickly, doctors concluded that it was probably a big piece of scar tissue from the tumor that the chemo killed. At that point, we were free to try to rehabilitate her. 9 months post-surgery, she was still not eating by mouth. She was not talking. She had recently in Chicago started doing therapies. She had just recently started crawling and pulling up to stand, which was huge. To see her make that big of a step, at least in her mobility. But the feeding and occupational therapy, her fine motor skills and motor skills were horribly weak, and her verbal communication was all a big concern to us. So we continued to do therapies daily. She eventually was able to start preschool and then progressed into kindergarten, and 3 years after we were able to stop all the treatment, she had started making sounds. We never got back any real sense of communication from her. Her motor skills and fine motor skills weren't good enough or strong enough for her to use an iPad or a communication board, and she was not capable of writing. There were some words that we thought we would get from her sometimes. Hi was very obvious. A lot of therapists and teachers would hear her say no when she didn't want to do something that they were trying to get her to do. We just picked up on things that she did and reactions she had to things. She would clap when she wanted more of something, whether it was to watch a movie again or hear a song again, but we never heard her speak words. Her mobility after 3 years had really improved. She was strong enough to use a gait trainer and a walker, and willfully able to crawl over to her gait trainer and get herself up into it and take off walking. To see her have that little bit of independence was remarkable after 3 years. She was still on a feeding tube. The school was making progress. She really didn't like eating with us at home for some reason. But at school, she was eating a cup of yogurt for lunch, which was not substantial enough to take her off the feeding tube. The feeding tube was still her primary source of nutrition, but being able to eat a whole cup of yogurt was a good amount of progress. At this point, 3 years after we stopped all the treatments, we did discover a new spot on her brain in the same location on the top that the original tumor had been. Because of its location, we watched it for several weeks because it could have been a benign tumor or just what they call a radiation spot that pops up a few years after radiation, and those are all slow growing. Unfortunately, this new spot did grow within a couple of weeks, and then again within a couple more weeks. So we were able to agree and conclude that we were probably dealing with a new ATRT tumor. As I said in the beginning, the options for relapse are very slim, and so we did our research and found trials and treatments all over the world and brought them to her doctors and discussed them one by one. We ended up deciding on a trial drug from St. Jude that was not only having success, but that was actually offered at our hospital in Washington, D.C. at the time. Lily did okay. The side effects were horrible, but the tumor shrunk and then it stabilized and then it grew. So 6 months after starting, we had to drop out of the trial and find a different option, which which there weren't many left on that original list we had. The other option was a protocol where there's no end and you continue doing it as long as it's working. And I had a friend whose son had been doing that, and it had kept his tumors from growing. He had been on it about 18 months. That felt like the most promising for us. We knew it probably wouldn't shrink the tumor. We knew it probably would not cure her. The tumor at the time really wasn't affecting her at all. So it just seemed like that option was more beneficial at the time. And in the meantime, while we kept it stable on those drugs, we hoped that another trial or another option would come available, not just stabilizing, but killing the tumors. So we started that, and whether it was the medications or the tumor itself, every month we had a new issue, whether it was seizures, high blood pressure, low sodium. We had an episode where she had one-sided weakness, like she had had a stroke, various things happening, and she also ended up in the ICU for 6 weeks, 4 of those on a ventilator, with acute respiratory distress syndrome that just spiraled out of control. It started as a cold. 8 months after starting the new protocol, Lily passed away. She went through a lot in those 8 months, and it just was too much. I thank you for bringing awareness, and I thank you for raising money. Any cancer parent will tell you that it is underfunded and that the treatment options are not only sparse, but they are usually not very safe for these kids. So that's our story, and thank you for giving me the opportunity to share it with everyone.